Welcome back to Early-ish in the Morning. Today I would like to talk about an aspect of the Medicare for All debate that I think is left out of the conversation far too often, and that is the economic benefits of giving every single American access to quality mental health care. So the concept of Medicare for All is obviously a completely government-funded public health care option. The idea is to ditch Obamacare and private health insurance and to just give every single man, woman, and child in America comprehensive health care coverage, period. No more having to worry about pre-existing conditions being covered, no more paying a $700 copay for a prescription every month, and no more $10,000 emergency room visits. Complete coverage no matter what. Two of the main arguments I constantly hear touted against a public healthcare option, and I am simplifying them to be fair for the sake of time, is that it is simply too expensive to pay for and that the cost is too high. And the second being, and this one's my favorite, healthy people shouldn't have to pay for the sick. I should point out real quick that America is the only westernized country in the world without a public healthcare option, and it shows with over 28.5 million uninsured Americans, and the fact that medical bills are one of the #1 reasons for Americans declaring bankruptcy. Now, there are multiple studies that indicate Medicare for All would actually cost the American people less money than our current system does. And I will link these studies for you guys to look at on your own time, because for now I want to address the naysayers that ask the question of whether or not it's my responsibility or yours as a healthy person to pay for someone else's cancer treatments. The easy answer to this question is, yeah, dude, that's how insurance fucking works. We all pay into a giant pot and then gain access to the pot when we need it. You don't buy car insurance right after you get into an accident, and like with any other insurance, including car insurance, you are paying for other people's accidents. That's how it works. But I want to go one step further, because I know that that answer isn't enough for a lot of people. I argue that you are already paying for the sick with your tax dollars at a much higher cost than you would be if we were to just pay outright for everyone's health care. More specifically, in regards to this video, I want to focus on the cost of Americans not having universal access to mental health coverage, because there are millions of uninsured Americans that don't have access to adequate mental health care. The country is actually paying a substantial amount of tax dollars towards the housing and detainment of people with mental illnesses that were unable to receive effective treatment. Couple that with the fact that it's more expensive to continually treat an illness through countless emergency room visits than it is to prevent a mental illness from reaching a point that it becomes completely debilitating to an individual through preventive care and regular psychiatric visits. Every year, on average, Americans spend $182 billion on incarcerating those unfit to live in society. It's estimated that at least 20% of inmates suffer from a mental illness. In 2013, Americans spent $201 billion on mental health care, more than was spent on heart disease-related illnesses, and it was estimated that the country lost $193 billion in revenue due to workers being unable to continue working because they were suffering from a serious mental illness. There were over 554,000 homeless men and women living in America in 2017, and 33% of them are estimated to suffer from mental illness. Homeless people are indeed a tax on the system economically, and they are unable to contribute to the economy in any meaningful way. The estimated expense of a single chronically homeless person is that it costs the taxpayer an average of $35,578 per year. I argue that giving mental health care coverage to every single American would actually generate revenue overall, because Americans who could not afford psychiatric treatment and were left unable to contribute to society would be given the help they need to get back on their feet. I argue that the rate of homelessness would actually go down, as well as the national incarceration rate. right, so I'm actually going to give you guys some more studies and statistics in a minute, but I actually would like to share my own story real quick, because I think it'll help paint a better picture of the way an untreated mental illness can dictate a person's course through life. So I grew up with what is called major depression from when I was 14 up until about when I was 19. Essentially, that means that I dealt with untreated thoughts of suicide and self-harm for a long enough period of time that those types of harmful thoughts became so ingrained in my psyche that they would basically represent themselves in some way every single day, and sometimes every second of every day. This is off topic a little bit, but it's actually funny. I remember one of my friends in high school. She was a straightforward girl, and one day as we sat at the lunch table in the cafeteria, she noticed that I looked depressed off my ass, and she said, "You know, why do you keep acting so sad all the time without talking about it when you're literally surrounded by people who care about you?" At the time, a comment like that pissed me off. Oh man, I was angry. It's such a weird thing to be angry about. You know, how dare you say people care about me? But looking back, I mean, she was spot on. I had this blind spot to where I couldn't acknowledge that there were actually a lot of people that did in fact give a shit. And I had a lot going for me. I was a very privileged kid. Unfortunately, when you're dealing with a mental illness, it can be almost impossible to accept any acts of kindness or even acknowledge that anyone could ever remotely care about your well-being. When I turned 18, I moved to Milwaukee and completed 2 semesters of school before dropping out to the fact that I had basically become too sad to function, to pay attention, or even really live life like a normal human being at that point. I stayed in Milwaukee after dropping out, found a rundown cesspool of a house to rent with some friends, worked shit jobs, made shit pay. I couldn't afford to eat most nights. Admittedly, I was a pretty useless member of society, and I didn't really care about my future or myself, for that matter. I could not make a competent decision to save my life, and unfortunately that almost became the case when I decided one morning to attempt to take my own life. Thankfully, I had enough common sense hidden somewhere to call 911 on myself, and that is not something that is easy to forget. It was actually the cops that came to my call that day, and I figure that they probably saved my life. They took me to the state-funded mental health facility in downtown Milwaukee instead of the hospital because I was unable at the time to adequately convey whether or not I had insurance. I was in a state of shock, essentially. Now, this institution they took me to was run down, old, and just in general had a terrifying look to it. Kind of like it was taken straight out of a Stephen King movie. And the cops walked me to the door, said sayonara, and left me to the mercy of the staff. At the door, they took my shoes, my phone, sat me down in this godforsaken waiting room for 9 hours. 9 hours I sat, and I observed a kind of desperation and sadness in the room around me that I had never since experienced. The room was a giant circle. In the middle were rows of chairs huddled together, and along the walls of the room sat multiple doctors and psychiatric professionals at tiny desks, listening to the dozens of patients that had been brought in that day on similar circumstances as myself. In my 9 hours, I overheard multiple stories from my fellow patients as they had their time to sit with the doctor. A few of them really stuck out to me. One boy who looked around my age had come in with severe cuts all along his arms. Just absolutely awful. And I remember when he sat with the doctor how normal it had all seemed to him. You see, he had been sent to the facility one other time already that same week. He very calmly told the doctor how he had just lost it for a bit that day. I guess he didn't have any health insurance because 20 minutes later he was free to go. Another girl in her mid-20s was brought in hallucinating, and she said that she couldn't afford her antipsychotics anymore. She also didn't have insurance, and she said that she couldn't afford to go to the hospital, and that she couldn't afford to even work in order to pay for her prescription because she was basically too mentally ill to function at a high enough level to hold a job. Another woman who looked around 35 was telling the doctor how she or someone close to her had called 911 about 4 times that same month because she was having bipolar episodes that put herself and those around her at risk. She had grown up in a poor neighborhood and she had never gotten treatment until a year prior, even though she had been told by doctors that she very likely could have been diagnosed years earlier. She also did not have insurance. I listened to story after story of these broken down people, and one by one they were sent back out into the wild. Of course, when I got my chance with the doctor, I had insurance thanks to my parents. They sent a car for me, drove me to a nice hospital, got into an outpatient program for a few months, not days, and I got the help that I desperately needed. I'm now a straight A student, able to work full time. I even quit smoking cigarettes, got in shape, and hell, I'm even going to school to become a social worker. And all of that is because I was fortunate enough to be able to afford access to adequate help. Because I had health insurance, my life went in an entirely different direction. For those other lost souls, they didn't have that luxury. And as a result, I can only imagine that some of them either ended up dead, in prisons, homeless, or sent right back into that same state mental health facility where some may never leave. When it comes to mental health, preventative care and early treatment can be the force that can not only save a person's life and improve their overall quality of life, but also allow an individual to once again become a productive, contributing member of society. In a study done by the NSDUH, they state that cost is the #1 factor for patients not receiving care for a mental illness. About 35% of American adults are not receiving care for a serious mental illness. A 2006 survey carried out by the U.S. Department of Justice reported that an estimated 10% of state prisoners reported symptoms that met criteria for a psychotic disorder. This survey was based on 2004 data, and the situation has gotten worse since then. Thus, 15% would appear to have been a conservative estimate. They go on to say that the overall estimated number of inmates dealing with a mental illness is 20%. And as most people are familiar with, housing inmates in the criminal justice system is funded by the taxpayer. Not only do I believe that at least a portion of the 20% of inmates could have completely avoided a trip to prison altogether if they were treated in time, and thereby saving taxpayer money, the Treatment Advocacy Center goes on and goes to go even further than that, and they say that mentally ill inmates cost more. Mentally ill inmates cost more than non-mentally ill inmates for a variety of reasons, including increased staffing needs. In Broward County, Florida, it costs $80 a day to house a regular inmate, but $130 a day for an inmate with a mental illness. In Texas prisons, the average prisoner costs the state about $22,000 a year, but prisoners with mental illnesses range from $30,000 to $50,000 a year. Psychiatric medications are a significant part of the increased cost. In July 2002, at Ohio's Clark County Jail, a prescription drugs costs for inmates exceeded the cost of actually feeding inmates. As far as the cost of homelessness goes in America, the Treatment Advocacy Center goes on to say that approximately 33% of the homeless are individuals with serious mental illnesses that are untreated. Many of these people suffer from schizophrenia, schizoaffective disorder, bipolar disorder, or major depression. The homeless population has increased steadily in cities and small towns since the 1970s. In Massachusetts and Ohio, 27% and 36% of people released from mental institutions became homeless within 6 months. So the second that they are released back into society, they're put right back into homes because they are not receiving the adequate level of care necessary for debilitating mental illnesses like major depression, and schizophrenia. Hospitalized people were 3 times more likely to obtain food from the garbage. Studies show that psychotic individuals are much more likely to get assaulted or threatened while homeless. Though officials believe that they are saving money by releasing patients from mental hospitals, there is a significant cost to the patient and to society at large. They go on to say that in 2001, a University of Pennsylvania study that examined 5,000 homeless people with mental illnesses in New York City found that they cost taxpayers an average of $40,500 a year for the use of emergency rooms, psychiatric hospitals, shelters, and prisons. Looking beyond any moral responsibility you may or may not feel that you have, I personally argue that we as a society do carry the responsibility to take care of those that are unable to care for themselves. Financially, though, you are already paying out of pocket each year for individuals suffering from mental health. Therefore, I say it is actually more financially responsible to give patients direct access to care that can prevent their mental illness from putting them in situations that can cause even more of a tax upon the system. Look, I want to be very clear. There are other outlets available to people for mental health care even without health insurance, and I will post links in the description. However, for people with serious mental illnesses, underfunded government centers, and the absolute bare minimum of care is simply not enough for many patients to start living a fulfilling and healthy life.